Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton, and I'm a maternity pediatric chiropractor and mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. And today I had the honor and privilege of interviewing a friend, a mentor, and a colleague, Dr. Karen Erickson, and we were speaking about the topic of better health with CranioSacral. So let me tell you a little bit about Dr. Karen. Dr. Karen Erickson has a family practice in New York City. She specializes in perinatal and pediatric chiropractic and craniosacral care. Dr. Erickson was a pioneer in ushering chiropractic into mainstream healthcare when she became the first chiropractor credentialed by a teaching hospital at Beth Israel's Continuum Center for Health and Healing in New York. She trained in pediatric craniosacral therapy with Dr. John Upledger. She is now on the faculty of the Master of Science in Integrative Pediatrics program at Logan University. Dr. Erickson has authored textbook chapters on pediatric chiropractic as well as chiropractic and integrative healthcare. She is the president of the Women's Health Council. Dr. Karen has appeared on TV and has been featured as a holistic healthcare expert in numerous publications, including the New York Times, Oprah Magazine, Prevention, and the Wall Street Journal. She is passionate about educating parents and healthcare professionals about the benefits of chiropractic and craniosacral for a wide variety of conditions and wellness care, which we go into in quite depth in this episode. For more information about Dr. Erickson, check out her website at ericksonhealingarts.com. Hi, Dr. Karen. Welcome to the show. I'm very excited to have you on today.
Thank you so much for having me.
So you and I have known each other for a very long time. You're an amazing colleague practicing in Manhattan, specializing in family wellness. You see a lot of children and infants in your practice. And I'm really excited for you to share your experience about working with children and infants, specifically using craniosacral. So let's talk about a little bit how you kind of got into that as a chiropractor.
Yeah. Well, I think that most chiropractors that are treating children know that even the chiropractic techniques are so incredibly gentle and non-force. And in many ways, craniosacral really fits with chiropractic like hand in glove. Like it's such a beautiful complement to chiropractic care. So if you happen to be in an area where there's not a pediatric craniosacral therapist, but there's a pediatric chiropractor, by all means, like you'll be in such good hands. But the craniosacral was really a powerful way to address the nervous system in a more comprehensive way, in my mind. So, we think about working in chiropractic, we work on the spine, from the atlas down to the sacrum. But what about above the atlas? What about in the brain, around the cranium? And so craniosacral it's actually a full body technique, but much of it is actually focused on the cranium. We think of the skull, right, as like a big football helmet, like it's just the bone. But actually the cranium is made up of different plates, different cranial bones that have a lot of play, especially in newborns. The cranial bones are sitting in membranes and they're not even fully formed. And there's a good reason for that. That's so that you can be born. The skull needs to be really moldable so that it can go through the birth canal. And that's why newborns often will have a molded skull, whether, it's a little misshapen, and usually within a day or two, it miraculously comes back to normal. But as we know, there are so many things that can happen during pregnancy, sometimes just related to something that's happening with the baby or something that's happened with the mom, like previous injuries the mom has had, or misalignments in the mother's pelvis, or even fascial strain in the mother's pelvis. Like we talk a lot, I know you talk a lot on the podcast about Webster technique and how valuable these techniques are for allowing the environment of the uterus really to have the space it needs to grow and be flexible so that the baby can turn and move and get into the optimal position for the birth. And then there's the birth itself, which I like to remind people that, a vaginal birth in many ways is like your first craniosacral adjustment, right? It just has this incredible ability to compress the cranium, and then you're born and the cranium expands. And that is the first, like literally the first flexion and extension. And then after birth, there can be all kinds of things that happen. Sometimes babies develop a torticollis, or their baby might be in the NICU for various reasons. The cranium can become restricted in ways that can affect the nervous system, can affect the baby's ability to turn its head, to breastfeed, to develop a strong latch. And then later on, other developmental landmarks that we would look for, like crawling, and even some organ function like GI function and things like that. So the craniosacral is such a beautiful technique to receive even during pregnancy, along with chiropractic, because it does address the fascial components of the body. And the fascia is the connective tissue, really. If you could imagine dissolving everything in your body except fascia, you would sort of see this ghostly image of kind of this exact image of every single structure in your body, every blood vessel, every organ, every muscle, every bone, everything is surrounded by fascia. And so there can be pull or strain. The fascia is actually it's vascular. It has a lot of nerve innervation, and fascia has a memory. It has a memory for strain patterns, injuries. So let's say a baby is in utero and their head is kind of tilted to one side and they're kind of compressed in that position. Let's say for the last month or the last few weeks, that will actually put a memory into that fascia to be in that position. And so sometimes the baby is born and they kind of assume that position. We even see it with like babies who cross their legs, like newborns, they'll always put one leg on top. It's, their left leg is on top of the right leg, and that's their comfortable position. And that's sort of a fascial strain position.
Or babies that are breech for the last several weeks of a pregnancy. Absolutely.
Yeah. And that in and of itself is like a normal response for fascia. So, we all are, that's kind of the miracle of fascia too, that it has this memory and it has this elasticity. But the cranial work can be so helpful for checking, particularly we love to check newborns, even babies that had ideal births. It's just such a relaxing technique. It's so gentle. The touches, we call it, it's like a 5-gram, very light touch. It's about the way you would touch to see if a tomato is ripe. It's like very, very gentle, and no pressure is ever put into the baby's cranium. So the work is sort of along the horizontal plane, along the cranium, and we're not pressing into the skull. But all the same, very, very effective. And, many of our patients come, many parents will bring their babies when there's a problem after birth. So there can be a whole laundry list of things that this technique is very helpful for. And I can list them here, but certainly a difficult birth, a very prolonged labor, or a very quick labor. They both can be stressful in different ways. And certainly any interventions, vacuum extraction, there can be forceps, of course, a C-section. Many times there's a very prolonged stressful labor and then an emergency C-section. So there can be many different things. Certainly we also look at the presentation of the baby that is born vaginally. So very often, I always ask mamas, like, how was the presentation? Was your baby? Oh, and they're like, yeah, head down. It was all good. And so a lot of mothers don't know that the baby's face is supposed to face backwards. And the back of the head is actually facing the mother's front. And that's the normal presentation. And the reason for that is that when you're going through the birth canal, you really want your chin to be tucked into you. If you even do it to yourself now, when you tuck your chin, there's a lot of protection for the head and neck, and even the brainstem area where the skull and the neck kind of connect. And if you're born the other way, it puts a lot of extension into the cranium and head and the upper neck and locks it. And very often we'll see these babies and they're lying on their back with their arms up, and that's their comfortable place with their arms up over their head. And the reason that we see that a lot in babies that are born posterior is that it causes an extension subluxation in their occiput, in the base of the skull. And this is something that with chiropractic and craniosacral therapy, we can easily address and just very, very gently correct that so that there's not that dural stress. The baby keeps their arms over their head in that comfortable position because it actually takes the dural strain out. It actually gives them more space, and they're much more comfortable that way. If you put their arms down, it would be uncomfortable. So we're able to change often just in a few visits. We can have a dramatic change in these babies. Other things that bring babies for care are issues with colic or reflux, or in some cases, full out GERD. And we love to be able to address these issues without medicating babies. We get such incredible results. The work is so gentle and so effective. And I always feel like it really needs to be your first line of defense. We also work with babies that are having nursing difficulties. And this can be a series of things. And very often children, will have more than one. So certainly some babies have a weak suck reflex. They just don't suck very hard. And sometimes the babies have trouble really latching or turning their head to latch onto a particular breast. So very often babies will latch onto the mother's right breast, no problem, and the left breast might have difficulty, or vice versa. And very often that's connected to a strain pattern in the cervical spine, where in order to breastfeed, you sort of have to tip your head to the side and rotate it. And if your neck doesn't feel comfortable, you have these babies they'll try to latch because they're hungry. They'll latch on and then they'll pull their head off after a number of seconds or minutes, and they'll kind of throw their head back. And it's almost like they're trying to unkink their neck. It's amazing. And very often I see pediatricians kind of diagnose that as a reflux issue. It could be a reflux issue, but very often I think it's actually a neck problem and a craniosacral problem where their neck is not able to move, not be comfortable in that position. So this work is so helpful for that. Anything we can do to prolong breastfeeding, to allow breastfeeding to happen at all and to prolong it is so good for the baby, and honestly so good for the mother as well. So we want that baby to function. It's incredible when you look at a newborn or even an older child breastfeeding, like sometimes when they're really breastfeeding successfully, they almost break into a sweat. It's a lot of work for the baby to do that. And that is so good for the baby because the baby's number one job is to develop its cranium, to develop its jaw, all the tongue muscles, the throat muscles, all of that has to be developed. And breastfeeding is just the best exercise going. So we really want to preserve that. And it is it's an enormous source of stress for new mothers. All they want to do is feed their baby. And it's really, baby cries, mother cries. It's really, such a challenge. And so I partner a lot with lactation consultants or doulas to make sure that we're working on the structure, and then the lactation consultant might work more on some of the technique stuff and also some of the strategies, of when to pump, when not to pump, kind of different strategies for optimizing breastfeeding. But the work we can do on the babies is so amazing.
It really, really is. I mean, we both do cranial work. We both see a lot of infants, and it's the sooner the better. I think that's the one thing I would want to share for moms listening, that there's no, like, we don't have to wait for a baby to be a certain age for them to come in and get this care. It can be immediately after birth. It's safe for them to get chiropractic and cranial work. And it's really effective, and it's a drug-free approach. And, babies that are just, uncomfortable or they're not thriving, they're difficulty feeding, there's difficulty sleeping, there's difficulty pooping. These are just all the things that babies have to do. These are basic functions. And if they can't do them well, then this is a really excellent resource for moms to bring in their baby, get care. I know in your practice, you also see the brand new postpartum mom. So it's like a dyad appointment, right? We do that as well. And that's also amazing. If the baby is stressed, the mom is probably stressed. And therefore, to help support the mom in being more relaxed and calm, helping with milk production, helping with her body recovering from the birth and pregnancy, then she needs to be under care as well.
Absolutely. Absolutely. I really see often that a lot of new mothers really almost have PTSD after. Sometimes it's just even a fairly normal birth. It's just a lot to go through. And then when something goes wrong, it's not a normal birth or it's not what you expected. And then if there's any issues with the baby, it's not what any of us would plan, but it happens. And this work can be so helpful at helping to regulate the nervous system, so we can starting with mama, get her back into more of a parasympathetic relaxation response, just gazing at her beautiful baby and being in love with this new baby, instead of the stress that happens from these kinds of issues, and then add in lack of sleep, and that can be a challenge. And for the baby too, I agree, it's never too early. I'm sure you have babies come right on the way home from the hospital, so they don't have to make another trip. And I like to think of it, when you're in the hospital with your baby, they do all these checks, right? They just check. They do even some blood work to just make sure that everything is good. They examine your baby. I wish that we were as part of that examination. I wish that every baby had a chance to be checked. Chiropractically and craniosacrally, it literally, in 15 minutes, you can just go through and check a baby and correct stuff. And then it's kind of done. Babies don't have big patterns, right? They haven't been around that long. So we can really clear these patterns, even in a baby that seems to be thriving, that seemed to have a good birth. It's not necessarily that they need a lot of care. I have babies that come in and go, this baby's thriving. Yeah, let me check them again in a month or two. I think for well babies, it's very important to get checked around the developmental landmarks and just to keep regular that way. And then certainly for babies that are having particular issues, we will do, a series of visits until we resolve that issue and know that it's stayed resolved. And then we'll see the baby. We'll, sort of separate out the visits and see the baby more periodically. I also want to say that, of course, we love to talk about the babies, but I want to encourage parents also to really consider this care for older children. It's amazing we'll start with, I'll just sort of go through the whole arc of childhood. So we talked already about breastfeeding and pooping and digestive issues. But for other developmental stuff, this work is incredible for babies who are getting ready to crawl. We all know that crawling is extremely important for babies, that it actually, the way the left and right body has to coordinate when you crawl actually helps the brain coordinate the left and right hemispheres. And we know that babies who crawl actually read better when they're 7. And that's why. So it's important. And it's incredible when you watch babies who end up going to early intervention, they actually end up practicing things like this, like crawling. And there's all these techniques that they actually use to help the baby to do cross crawl exercises where you would take the right leg and the left arm and move them exactly at the same time. You can actually do this to your baby. And then you coordinate the left and right hemispheres. And you almost think, shouldn't every baby have this? Like, shouldn't every baby do these fun exercises with their mother, or father? And I actually often will teach parents like really fun little things to do with their kids so that they can practice. And even before that, we start doing that with tummy time. And as you know, babies sort of develop from the head down. So the first thing that has to develop is neck strength. And if they don't have good neck strength, they're not going to have a good view of the world. They're going to be face planted. And we don't.
And they're not going to like tummy time.
They're not going to like tummy time. And so there are all these tricks for bringing babies into tummy time. You can prop them up with something under their chest to start with, and you can put their elbows under their shoulders so that their arms are kind of propping up and get them to start to learn how to push. First thing, head gets strong, then the arms, and then the torso. So if you put your baby in a seat before it has that core strength, before it has the head control, you prop your baby's head up with a head support instead of their own muscles, you kind of deprive that baby of its job. And the job is to develop the neck strength first, then the arm strength, then the core strength, and then last hips, legs, so that they can crawl, and then they can eventually walk. So I love just educating parents about that process and using CranioSacral for crawling, walking issues, to make sure that the fascia is clear and allowing their entire musculoskeletal system to do these important developmental landmarks. But there are other things that we work with children, also children that are having issues sleeping.
Yes.
Children who really are having trouble settling down. It can be really extraordinary. One of the things, and I'm sure you do this, Dr. Laura, too, after a session with a baby or a child, I'll say, don't be surprised if your child has a really long sleep after this.
It's very common, long naps.
And sometimes parents almost get alarmed, they'll go in to look at their baby, is my baby okay? My baby or my child, they're still sleeping, Yep, they're still sleeping. Everything is fine. They're just sleeping. So that's very healing. Sleep is so important to all of us, for mothers and their children. And the CranioSacral can be extremely effective, again, because it helps regulate the autonomic nervous system.
I was going to say, it's the equivalent of hitting the reset button on your computer. Your computer has to shut down and then it can power back on. And so that's what happens after these visits is the computer of the body is the nervous system, and it needs to shut down, which is sleep, right? And recalibrate, heal, do its thing before it can come back on. And so that's why sleep is so important. And we see babies that are not napping well or not sleeping well and waking up several times a night, or very irritable, gassy. These babies are overtired, and that's also going to impact their growth and development, especially that first year of life.
Absolutely. And we also see this as an issue with older children as well. When you start to get into the school age years, sleep is a really big a really, really big topic, even in teenagers.
Yes, high school students.
And it's one of the things I love to work with teenagers, and actually middle school age. They're really starting to get a sense of autonomy. I love even just the way we help children, I think, as chiropractors, become more nuanced about their own health and how they are. So I might ask, a middle schooler, how are you? And they're like, fine, thank you. And I'm like, that's great. So tell me how your body is. And they're like, a lot of children they don't even know what you're talking about. So, and understandably. So I say, well, tell me, first of all, how are you tired, or you have good energy? And then they'll tell me, and then I'll say, are you, does anything in your body hurt, or does it bother you sometimes? And we'll kind of go through it. How's your digestion? And so, my patients will get to know, like, if they're tired, they can think, well, is it a sleep issue? Am I drinking enough water? Did I eat on time, or did I not eat for a long time? Like, what might be causing these symptoms, and what can I do? What proactively can I do to sort of take care of myself and to become more nuanced? Like, am I tired am I getting sick? Do I have a headache? Do I have my sinuses congested? Like, and just to sort of start to become a little bit more nuanced so that they can have agency in their own body and know how to take care of it.
That's one of the most beautiful things I see in my office is kids who've been coming in for years. They're so connected with their body. When they come in and I'm like, okay, how's it going? Tell me, how's your body doing? They can answer that question, as opposed to a child who's never been under care. They are like, oh, I kind of feel my left ankle's a little stiff. And, I notice like a little twinge, like, they can communicate that, and they're noting these things. And, some people are like, oh, when I get adjusted, I really am more in tune with my body. And some people don't want to be in tune. They're like, I don't want to listen to all these symptoms and signs that my body's telling me. But this is really important. We don't want to cut the engine light, to turn off that light, the wire, so that we don't hear those symptoms. We want to actually hear and respond accordingly to what our body's telling us.
Yeah. And it's kind of miraculous that, I'll see like 3-year-old kids telling their mother that they need to see me.
Yes, me too.
Like, you can't even believe it. Like,
they're like, oh, I just fell. I need to go see Dr. Laura. They get it.
Yeah,
or
exactly.
I feel like I'm getting a cold. Like, they really understand they're off, and how they get back on is a chiropractic adjustment.
I was just talking to a patient of mine who doesn't live in my area anymore. And she says, my son, who I really saw last time I saw him was about 3 years ago. It was before the COVID days. And he kept on saying, I need to see Dr. Karen. I need to see that, that person, can you bring me? And the mom's trying to figure out like how can she manage to bring her? It's like, more than an hour each way, but she will. But she says, it's like every other week or two, he brings it up. So it's a kind of a beautiful thing. I also think that the whole generation of school age kids are having a lot of unique challenges in terms of technology. For the first time, we have, these kids are digital natives, and they're on screens their entire life. They're looking down a lot. And when you think of it, they're sitting for school, often for, if they're commuting, and then they're sitting for school, and then they sit for relaxation after school, and then or homework. And so then they're also using screens. So they're looking down so much time. So those are things that really affect kids. And then you add on some heavy backpacks where kids are still required to, I think we thought by now everything would be digital, and you'd have like a little keypad, and that would be it, and everything would be online. But I think it's it's almost worse now, because they have computers and all the textbooks, and they have to have them all in class. So that's a challenge. This work is more important than ever to help children with postural issues, to help children. We never used to see, Dr. Laura, that, I don't know, even like 20 years ago, if a child came in with headaches, it was very worrisome. It
was. And now it's more and more common.
Really took notice, like there might be something really serious going on. Now, almost universally, it's not that uncommon that 7-year-olds get headaches from screen time, because they're looking down so much, because they're, the combination of heavy backpacks and looking down. So this is something that parents can do their best to be aware of, but it's really challenging when kids really are on computers or phones to socialize, to do schoolwork, to do homework, and for entertainment. So it's so many hours a day. So yes, I think getting your kids out running around and playing and doing
So
other
important.
activities, so important. But I also think that it's almost necessary, sort of like you bring your kids, you brush your teeth every day, but then you bring your kids to see a dentist, right? That it's so important that kids periodically, but on a regular basis, get this kind of work.
Because we have to counteract, like, this is life. Screens aren't going away. Technology is not going away. As much as we don't want our kids addicted to screens and things like that, there is a certain, necessary use of them. And, as parents, we can have limitation and guidelines around that. But yeah, how do we manage this? And I also want you to talk a little bit about the higher emotional stress that kids are going through, pandemic, cyberbullying, social media, things that we didn't have to deal with when we were kids. This is all new. As parents, we're all trying to figure out how to navigate this. And kids are having a lot of anxiety and a lot of depression, even at really young ages now. I know that the pediatric therapists, mental health therapists in our area have waiting lists. They cannot even manage the load of the mental health crisis for children. So how can we be part of the team for children that are feeling these really big emotions and are really stressed out?
Absolutely. I think that there's so much that parents can do to create a good foundation, feeding your child well, making sure there's sleep, making sure there's exercise, creating a good emotional environment in the home, and surrounding your kids with as much positive friendships as possible. But then there's another element where you start to really get into the stress response, and it's sort of challenging sometimes to change that. And the CranioSacral can be really very helpful. In a way, I think of it almost like as having similar effects to meditation. And the challenge sometimes is, and I recommend actually meditating with your children when they're old enough. There are online, there's all kinds of programs that you can tap into, even for very young children, that might only be like a 3-minute meditation, where you're just not going to sit very long, but you start to get your child into mindfulness, noticing their breath. The cranial work I do, I feel like I'm sort of holding that same space for that child, but I'm just touching them, holding their line. We keep children just to paint a picture of what craniosacral therapy would look like. I like to keep children completely dressed. I want them to be warm. I want them to be comfortable. I have them lie on a table on their back. If they're chilly, we can put a blanket on them. The mother's usually, or father is right there. And we will just gently put my hands over their clothes, like on, various parts of their body, usually on the, we call them the transverse diaphragms. So, their belly, their diaphragm, their upper rib cage, and sort of where their neck and their skull meet, sort of at the base of the skull, and then on the cranium. And again, the pressure is so gentle, but it really helps the nervous system shift out of fight or flight, that stress response that we get looped into. And we see this in children a lot. It can start at a very young age, but it can escalate, especially with the kinds of social stresses that you just mentioned, Dr. Laura. So I love to do the craniosacral work. It just, our nervous systems really create different patterns, and you can really create a pattern for a relaxation response. And if your body goes into it once, maybe twice, maybe 3 times, it then starts to go into it more easily in the future, even when you're on your own. And that's what we want to do, is kind of create a pathway for your body to get out of fight or flight into a relaxation response. And a lot of my patients they'll kind of get up off the table and they'll just be like, I can't believe how I feel. And I said, I know, right? Like, this is normal.
Right. Feeling amazing is normal. What a concept.
This is like your birthright. Like, this is what we were born to experience. And I want to set the bar for you now. This is your new normal. This is the real you. This is the real you here. And it's a beautiful moment. And I think once you've experienced that even once, you always want to go back there and dip into that. It's not a state that any of us stay in all the time. It's, it should be part of a spectrum of states that we're in. So, but it's a very important, really, to dip into that state every day, and to be able to operate in more of that state, and that is a challenge. So I love the cranial work for that. The other thing I really love about it is I especially like it for like middle school and older kids. I'm a huge fan of therapy, and for kids, it can be really life-changing. But what I love about the cranial work is that it can really shift the emotional state without the dialogue, without having to talk about it, without having, anyone to tell me all the details of what it is. That can be very valuable. It's certainly not my scope of practice, but I'm not saying it's not valuable. It can be. But what I love is that we can sort of hold a space in a craniosacral session and have the child just experience this relaxation without having to talk about all the problems or what exactly is bothering them. And it can be very, very powerful. And I think we're also finding in the work on trauma that's coming out now, that it's maybe not actually counterproductive to talk about trauma. It actually re-traumatizes children that have been traumatized. And I think it's important to let parents know that a lot of kids are traumatized in a lot of different ways. Sometimes it's medical trauma that they've had or other kinds of trauma. Sometimes it could be like a car accident or some other, someone in a close family member passing away, or there's all kinds of things that happen in good families that are considered trauma. And that I'm so grateful that there's so much beautiful work coming out on how to deal with trauma. And CranioSacral really is one of those techniques that can be very helpful because it really reestablishes like just a healing relationship, but does it without a lot of words. And there can be talking in CranioSacral, and that is certainly allowed. And sometimes the sessions can be chatty, and then all of a sudden the child will just take a breath and then just really relax, and there'll be silence for a long while. And that can be very therapeutic and very healing as well.
Yes, that is such a good point. I would say that we know that stress and trauma can be stored in the body. And I do believe just talking about it isn't going to get that out of the body. And sometimes too, which is why we want body work, right? We need something that's hands-on, that's going to help us move that trauma out of our system. And what if some of the traumas are subconscious, right? Things that happened to us when we were in utero or as a baby, that we're not really conscious aware of. We can't talk about things that we're not conscious of, right? So, but they can still impact us. They can still impact our decisions, how we operate, how we react to our environment. And so that's really the power of this type of work, is we can move things out without having to know the whole story.
It's so true. I bouncing back to, we started talking about babies, but let's talk about babies and trauma. So, in a lot of ways, I'll tell moms, like being born is a marathon for the mother, but it's a marathon for the baby too. Even a normal birth, it's a heroic feat, just to be born. And the baby goes through a lot, and sometimes the birth is less than perfect. You might have a seemingly normal birth, but maybe during the birth process, the baby's shoulder gets a little stuck, and the baby goes through several cycles of contractions where that shoulder is stuck and it can't free it, and it's trying to maneuver its way through the birth canal. And then finally the shoulder gets unstuck and the baby is born. So these are little things that can happen, but sometimes they're more dramatic. And so it's interesting when we're doing craniosacral on a baby, and I'll be working through of starting on their pelvis and working up their body, and I'll get to the rib cage and the shoulders, and I'll just feel a restriction there. And I'm holding the baby's shoulder like featherweight, just the lightest, I'm kind of just caressing the baby, just holding the shoulder, maybe one hand under the shoulder, one hand on top of the shoulder, and feeling for that fascial strain. And then all of a sudden the baby will start crying. And you're like, I know I'm not hurting this baby. I'm using the most gentle pressure. And we don't really ever, like, the baby can't tell us, but very often in that case, it might be that baby, oh, wow, last time I felt that shoulder, that was the shoulder that got stuck. And it's a body memory. It's not that the baby is thinking that, the baby doesn't have language yet. It's really a body memory, like, oh, you're going to that place. And that's actually in those moments when we can really release those patterns. And the wonderful thing about babies is that the pattern wasn't there that long. So if we can release it and open up that shoulder, all done.
Exactly. They have a new normal. They don't have to grow and develop with a restricted shoulder, which is going to literally can stay with them for their whole life. Even I'm sure when you have a new patient as an adult who's never been under chiropractic care or CranioSacral and they're 40, 50 years old, they can have some chronic issues and arthritis and all these things going on in their body. And they're like, I don't know where this all came from. And it's like, maybe it was from their birth.
Those are the people, right? They got like a rotator cuff tear, or they have a bursitis in that shoulder, and or it starts to throw out their cervical spine because they don't have mobility in that whole part of the rib cage, or it affects their respiration. Absolutely. I'm thinking also that we should talk about tongue tie.
Yeah, we have a few more minutes left.
Perfect. Because I know this is something, fortunately, that is getting diagnosed a lot more. And I think it's something that mothers can ask that it get checked, especially if there are any issues breastfeeding. It's the earlier, the better. But I have to tell you that I just had a 9-year-old girl in my practice have a tongue tie correction. Got missed when she was a child. She breastfed okay, but she was having sleep apnea. And this very brilliant dentist actually found it, and it made a huge difference. And she was also having sort of headaches and some neck issues. And we would work on it, and it would get better, but sort of kept on pulling back. And that was really that fascial. Yeah. So, a tongue tie can be, actually, there are lingual ties. It can be under the tongue between the lip tie, and it can also be buccal ties. And in addition to breastfeeding and having a strong suck reflex, being able to latch on correctly, it also can really affect swallowing and articulation, like in speech. So these are reasons why, and also breathing. Airway, exactly. Breathing, potential sleep apnea issues. So, and mouth breathing in particular, we want to avoid. I was just reading about how Native American mothers used to, after they would take the baby off the breast, they would take their hands and close the baby's lips. So that they would just train the baby to breathe through their nose all the time. that if the baby was sleeping and they were mouth breathing, they would go and close the baby's mouth, to kind of reinforce that no, you breathe through your nose always, and that not breathing through your nose actually like ruins your sinuses. Like it'll actually give you sinus problems. A lot of people think it's the other way around, but it can happen that way as well. So, and it ruins your teeth also. So it's really incredibly helpful with any kind of tongue tie to have CranioSacral before you have the release done, so that we can really release all the fascia. It'll actually let the actual surgical procedure be even more effective, and probably release a little more than it would. And then we, of course, check the baby afterwards and work on that baby, and it really makes the procedure even more effective. So sometimes I have patients who are also working with like an OT or a physical therapist that specializes in oral issues, and that's great as well. But but I love that they're now referring, like I'm part of the team as a craniosacral therapist. And they might say, well, why are you working on my baby's shoulder or pelvis when we're here for the mouth?
Right. We just want to be able to breastfeed.
Fascia is all connected. So if there's a big fascial pull in the pelvis, let's say in the shoulder, just correcting the mouth, of course, it's going to help. Of course, it's important, but it's even more effective if we can clear all the fascial strain.
Yeah, it's working on the whole body.
Yes. Yeah, absolutely. And I am happy to see that more babies are getting checked for this and having that corrected.
One thing, though, that I do find in my community, at least, is a mom might ask her pediatrician to check for it, and the pediatrician will say, oh, it looks fine. And they kind of just blow it off. And it's from really just a lack of education. They're just not really majority are not properly trained to diagnose one. Which is kind of strange to me. So essentially, you also have to know who you're asking. I've even had ENTs in my community who kind of blow it off too, and don't really don't number one either identify it, or if they do, they're like, oh, it's small, don't worry about it. And then I take a look and I'm like, this is not a small tie, and we get them to a practitioner who's skilled in releasing this. So it's also going to somebody who specializes in ties, who knows how to identify them, knows how to correct them. That's really important.
Absolutely. And, just so parents know, it's a very simple procedure. It's done in the office, and then they give you exercises, little stretches to do on your baby afterwards to make the surgery even more effective. The after stretches are very essential because you basically want to slow down the healing so it doesn't heal too quickly, because you want to keep it open, and you don't want it to reattach. So, but I totally agree. I have a handful of people that I refer people to, and they all they do are ties. And I also tell them, listen, these doctors are busy. They don't need your business. Like, they're not going to tell you to have a tie remediation if it's not necessary.
Correct.
So I really trust them. And very often it is necessary, and it can be, really life-changing to the baby.
Life-changing. And it is so much beyond feeding. Like, I've even had babies who the mother had already discontinued breastfeeding. So like feeding wasn't really an issue at this point. And, but the ties were pretty significant. And I could just see how that was also impacting the cranial work I was doing was not as mobile, even in like a 4 or 5 month old baby, because of the fascial oral restrictions, right? Because that impacts the entire globe of the skull. And we're seeing now some plagiocephaly, brachiocephaly, asymmetries of the skull that are kind of getting locked in because of these tethered oral tissues in the mouth, right? It's like this is connected together. So getting that released, can work outside the skull, inside the mouth, and we can get much better movement in that fascia because of that revision. And I know that this child's going to be set up for success when they do start solid foods and they start speaking and they start breathing with their mouth closed, because they have a palate that's wide enough at the base of their nose so they can breathe through their nose. And all the things, even posture, right? I'm learning now, people with really severe forward head carriage can be because they're trying to open up their airway because their tongue is in the way. So, and like you mentioned, the sleep apnea, which children can have as well. We see that their symptoms are ADHD and bedwetting and not, and headaches, not typically what we see in adults. It's different, but it's impactful on their health.
Absolutely. And I wanted to just mention, maybe as a final thought, the plagiocephaly you brought up, super important topic, something that I work on every single day in my practice. So as parents may know, plagiocephaly is when part of the skull is flattened. And the babies can be born that way, but very often it's called positional plagiocephaly, where the baby maybe has a neck restriction in range of motion and tends to lean on one side of the head, and it flattens out. And so CranioSacral can be extremely helpful for that. And very often the medical model is just to put a helmet on that baby and to mold the cranium. We can't change the shape of a bone. The bone, it's sort of like changing the shape of your forearm. Like it's the bone is the shape of the bone. But the wonderful thing about babies is their craniums are growing and they're not fused yet. So they literally will grow if there's an asymmetry, and you actually release the dural tension around that restricted area, their cranium will actually grow to make their cranium more symmetrical. And it's remarkable. And we're doing that really by clearing the dural strain around the cranial bones, but also within the brain itself. And so the bones are actually attached to the dura and attached to this fascial sheaths that move around the brain and through and between the hemispheres of the brain. And so addressing that fascial strain is actually a more effective way of dealing with this that impacts the child in so many other ways besides the shape of their head. And so sometimes I'll have parents who are like, we really want to do the helmet. Our doctor's really pressing us. We want to do it. And I'm like, okay, fine. Like, let's do the helmet. And let's also really still address all the underlying stuff. And that is an amazing way to go as well. I have another family, the pediatrician really wanted to avoid the helmet. And very forward-thinking pediatrician, and said, no, you have to go see Dr. Erickson. And it's been kind of this remarkable thing. I've been treating the baby for about 2 months every week, and most weeks twice a week. And it's just incredible. Like one orbit of the eye was smaller than the other. They're now even. The distance from like the top of her head to her chin on one side was much shorter than the other side. That's evening out. And the plagiocephaly itself is almost resolved. I'd say it's 80% resolved. And as I tell the parents, I'm not changing the shape of your baby's cranium as your baby grows. Fortunately, we're in this beautiful growth phase. She is actually rebalancing it as we restrict the fascia. So it's a very helpful technique for parents to know about. This is something we see a lot in the pediatric population.
It's becoming so much more common with the back to sleep movement as well, where parents are encouraged to have their baby sleep on their back, and there's more opportunity for flattening of the back of the skull.
That's exactly right. Yes.
So we want to just really also just not have our babies on their back all the time. And, tummy side movement is key here. And the one thing I would mention is the earlier we see a baby, typically with this type of cranial work, they don't end up developing that positional plagiocephaly. So we can actually prevent that from happening if they're saw as a newborn. But I know you and I both see babies like now they're 2, 3, 4 months old. They have the head asymmetry. And if the parent does decide to go ahead with the helmet, doing that with cranial, they will just accelerate the helmet process. They have a shorter duration and they have to get the helmet adjusted more frequently because we're working on the dura inside the skull, and there's going to be quicker change.
Absolutely. This is what I see, babies, normally they might wear a helmet for 6 months and they're out of the helmet in 3 months.
Yes. It could be literally half the time. But, ideally, like you said, if we can even prevent that helmet by earlier care and not even waiting till that baby does develop a flat head to work on their the meningeal system and their alignment, we can really just optimize symmetry between the right and left side of the body and the skull with this care. And it's just a beautiful thing.
Absolutely. Absolutely. And it has such a profound, besides what it looks like, it's having such a profound effect on how the nervous system can function, how you perceive everything, and how you integrate the function in your body. Yeah.
Beautiful. Well, thank you so much for coming on and sharing your passion, your wisdom for this work. You've been doing it for so many decades, and I just really honor and appreciate you.
And same to you, Dr. Laura. Thank you so much for having me.
Well, I hope you enjoyed today's episode. I think the big message here is how powerful, safe, gentle, and effective chiropractic care is for children, even very little infants and newborns. They can benefit from this care. And when you work with a practitioner who also does cranial work, like myself and Dr. Erickson, then your child is going to get the benefit of having their skull and cranial bone alignment addressed, which directly impacts brain and cranial nerve function. And therefore, the 80% of our nervous system that's housed in our skull is also receiving dramatic improvement and benefit from this type of care, which is very gentle, drug-free, and effective.